Hello and welcome to Common Sense Matters. I am your host, Sandy Rice. This is a bi-monthly radio show that provides more information on the history, politics, and policies of our state and county, more than local media, and certainly more than online national media. I did a similar podcast in 2018 to 21 called What About Us? You can still get it on Apple Podcasts, and a lot of good information is still pertinent because a lot of times things don't change that much. One of my favorite guests during that time was my friend, Dr. Carol Paris, who is here with me today. Welcome,
Hi.
Carol.
Hi, Sandy.
We have been fighting battles around healthcare for a long time, haven't we?
Well, quite a long time.
Okay. Carol is a retired psychiatrist and past president of Physicians for a National Health Program and is still active with that group, especially with our topic today, which is Medicare Advantage. Whose advantage? But first, I wanted to update you all about the voucher program we've discussed on several programs. We on Common Sense Matters opposed using public money for private schools because, it didn't make sense. Well, even after a lot of school boards, county commissions, teachers associations, students, and parents opposed the voucher program, it was passed last Thursday in both the state, House, and Senate. It is now headed to the governor's desk with a price tag of $445 million this year. Now, I went, and there were many amendments that proposed that would have made the voucher program more equitable and transparent, but they were tabled or defeated. It was a fast train rumbling through the Capitol. Passing vouchers was something that Governor Lee wanted to get her done. The vote was closer than expected. In the House, it went 54 to 44 against. So many House members crossed party lines, probably because they were representing counties with no private schools, so no benefit to the students there or school choice. But our representative, Iris Rutter, did vote to support it, voted yes. Senator Janice Bowling voted no. Two issues are still vague, which include funding for the repair of public schools, school buildings versus Hope scholarships. They also made an addition of a mandate that school boards sign a resolution in favor of the voucher legislation before receiving the teacher's bonus in the district. So that seemed kind of an odd thing to do. But anyway, moving on, Carol is going to discuss Medicare, traditional, and the Advantage program, and then I will talk a little bit about Medicaid, what we call TennCare. Carol, please provide us with some divinations in Medicare.
Thanks, Sandy, and thank you for all the work you're doing at the state level on this voucher debacle.
Yeah,
I'm going to talk about another debacle called Medicare Advantage, and let me start by saying that, historically, Medicare, traditional Medicare, was a piece of legislation that was passed in 1965 because prior to that, the elderly were oftentimes completely uninsured. They were not able to get insurance from the commercial insurance companies because of
medical problems.
Right, and medical underwriting. One of the things before Obamacare that insurance companies did was they would assess your physical condition and any medical problems that you had prior to making a decision whether they would insure you or not. And so that simply precluded many of the senior citizens who were just not a good insurance risk.
Right.
So Medicare was passed, and it is paid for through the the Medicare Trust Fund, which everyone who is working contributes to over their lifetime. That's also what pays for Social Security.
Right.
And so it's kind of like a savings account. an enforced one that everyone has to put money into, but then everybody can benefit from when they reach 65.
So they're not entitlement programs.
No, they are not
'Cause
entitlement.
you paid for them.
You paid for them.
And if you didn't work a certain number of
Quarters.
you don't get it.
Right. So it's not an entitlement program.
It's not a giveaway.
So then built into the Medicare program, unfortunately, are some drawbacks. And over the years, they have, as the cost of health care has gone up, so have some of these sort of drawbacks of the Medicare, what's called the benefit package. So I'll start a little bit of talk about the cons of traditional Medicare. I'm not going to say traditional Medicare is without flaws.
Okay.
It requires a premium for Part B. First of all, it's complicated. There's Part A and Part B, and then later on we passed Part D, which is the drug your drug plan. So with Part B, you have to pay a 15% co-insurance for that covers everything that's sort of not hospital care, and that can be expensive. And with Part A, you have this year it's about close to $1,700 deductible for inpatient care before insurance pays. But you can spend $1,600
just walking in the door.
Walking in the door. So those are some of the drawbacks of traditional Medicare. It's a little confusing. It's called an out-of-pocket maximum. There's no out-of-pocket maximum with Medicare. So if you're very ill and need a long time in the hospital and maybe a long time in long-term nursing care, you could still end up, it could end up costing you tens of thousands, if not hundreds of thousands of dollars. So that's the drawback of traditional Medicare. What many people do is they buy a second premium called a Medigap or a Medigap plan. Right. And that covers all of that Part B co-insurance that traditional Medicare without a supplement doesn't cover. But it costs a premium every month. And so that's where we were in 1965 and going forward. You will recall that in the 80s, there was this movement started by, I guess, Ronald Reagan, who said, the government isn't here to fix things. The government is the problem. And so it really created this mentality that the government can't do anything right. The government is inefficient, and commercial industry, can do better because they're so much more efficient. And so the insurance industry started pitching to Congress that they could actually manage Medicare more efficiently and save money. And so we ended up with a piece of legislation in, I think, 2003 that authorized commercial insurance companies to offer a product in lieu of traditional Medicare, and that product is called Medicare Advantage. And again, it was premised on the idea that industry can do things better and more efficiently and save money. Well, here we are in 2025, and in fact, Medicare Advantage is overpaid somewhere between $88 and $140 billion a year. And so it is actually costing the Medicare Trust Fund somewhere between 22 and 30% more per person covered by Medicare Advantage than if that person were covered by traditional Medicare. So it is not saving money. Mm-hmm. There is also no evidence that it is producing better outcomes.
Okay.
Okay? So those are two facts I think are important to know. But I also acknowledge that on the individual level, the person turning 65 and having to make a decision, do I go into traditional Medicare or do I choose a Medicare Advantage plan? There are a lot of benefits, or the benefit package can look pretty appealing for Medicare Advantage plans because they advertise little or no premium and a annual out-of-pocket maximum, which this year is just a little under $10,000, which is still a lot of money. Now, granted, most people don't reach that point because they don't use that much care. But if you ended up with a catastrophic situation, the most you would be out of pocket is $10,000, rather than, as in traditional Medicare, there's no out-of-pocket max. Okay. And then another benefit or advantage of Medicare Advantage, a thing that makes it seem like a good deal, is that it is simpler. It covers your Part A, your Part B, and most plans cover your Part D drug benefit.
Okay.
So it has simplicity, it has an out-of-pocket max, and it has potentially zero or very small monthly premium.
Sounds good. What's the catch?
Here's what they don't tell you. Number one, even if you choose Medicare Advantage, you still pay a monthly Medicare Part B premium, which for most people this year is $185 a month. So that's going to come out of your Social Security check or whatever.
Your income.
Yeah, regardless. What they also don't tell you is that they have co-pays for many of the services that people use. So if you're paying a co-pay for every visit to the doctor's office, that can add up. And what I read recently is that if they took the average of what senior citizens who chose Medicare Advantage, if you took the average of what they're paying in co-pays for care every year, it actually amounts to about 80% of the cost of a supplemental plan
under
Medicare. So people choosing Medicare Advantage because they think it costs less money aren't really looking at the big picture.
Okay. Does Medicare Advantage cover dentist and eyeglass?
It has
care?
these additional benefits.
Oh, that's extra, though.
Extra. And those sound appealing, but that's another thing. We've now had 20 years to look at these plans and how they're actually being utilized. And in fact, those benefits are very underutilized. And there's lots of reasons for that. number one, they don't cover everything. So if you need dental work after your dental exam that's covered with your dental plan or your dental benefit, well, then they say, it's going to cost you another $10,000 for this implant that you need.
Or crown, or crown.
Or crown, or root canal. And you're back where you started from because you've already used up your very, very minimal. Okay. Dental benefit. Okay. So those are the things that the individual person has to consider. And it really isn't a big surprise that more and more people, especially people with lower income in retirement, are choosing Medicare Advantage because they see this shiny object called zero premiums and these shiny objects called dental, vision, and hearing. And those shiny objects blind them to what they can't see, which is that zero premiums doesn't mean you're going to get care at no cost. It means, in fact, you're going to get care and you're going to get a copay every time you get care. And as I said before, dental, vision, and hearing, those benefits are extremely limited, and in many markets, they're very hard to access. So you may, in theory, have a dental benefit, but you won't be able to find a dentist who accepts,
take it. I was just going to say, you get to keep your own doctor and your own dentist. This was a big thing with Obamacare, that you had to go to someone that was, I don't know, certified or in the network or something like that. So because they've worked out deals with. So those are the considerations on sort of the individual person listening to this who is either 65 or approaching 65 and contemplating the decision, or people who have already chosen a Medicare Advantage plan and are finding that maybe this plan isn't covering all the things they thought it would. So, yeah, you can change plans every year, but you're still going to face the same kind of problems. Now, on the bigger level, sort of at the national level, as I was saying, Medicare Advantage plans are draining the trust fund, the Medicare Trust Fund. They are overpaid, and I'm not going to go into the weeds about all of the ways that happens. But it is the research is well established that we are overpaying Medicare Advantage plans. What are they doing with that overpayment? Well, it turns out that United Healthcare, which is the largest Medicare Advantage insurer, is also the fourth largest company in the United States and the 10th or 11th largest company by revenue in the world. Oh.
I'd say they're
doing pretty well?
Doing pretty well. And what does doing pretty well mean? It means that they're a for-profit company that has investors. And those investors expect ever-increasing profit quarter after quarter. And if United Healthcare doesn't show that they're making more profit quarter after quarter, then they're at risk of having their investors take their marbles and play in someplace else. And let me tell you, that translates into
a lot of money.
Billions and billions of loss of what's called market capitalization, value of the stock. And most of the CEOs who are paid huge amounts of money, the majority of that income is in stock. So they want to make sure the stock is at the highest value they can run it up to as well. So there is that. Another thing to consider on the sort of more global level is that Medicare Advantage plans are not paying hospitals the way they should. And larger hospital systems can sort of handle the fact that Medicare Advantage plans traditionally delay payment and oftentimes even deny payment after the care's been provided. But rural hospitals don't have that kind of
Mix.
flexibility and profit margin to be able to float that. And so a friend of mine did a survey recently interviewing CEOs and CFOs of rural hospitals. He sent this survey around to rural hospitals around the country and got about 41 respondents. Unfortunately, none from Tennessee. I would have liked to have seen that. But the result of that survey, the absolute unanimous number one problem identified by CEOs and CFOs was Medicare Advantage. That Medicare Advantage was the most difficult payer, both to get them to pay on time and to not have them come back after you've delivered the care and retroactively deny payment. Well, what do you think that does to rural hospitals?
They don't run. They close
They
down,
close.
which has been an issue in Tennessee. We don't talk about that very much anymore, but we should.
Do you know that I think it's still true that Tennessee has more rural hospital closings per capita than any other state in the union. So when you think about some of these issues at the sort of more national level, I hope you can understand why people like me are saying this is something we really need to change. So here's what I recommend and propose, and what my organization, Physicians for a National Health Program, is currently working on at the federal level. And that is to modernize the traditional Medicare benefit package and bring it up to par, put it on a level playing field with Medicare Advantage. What we would like to propose is that traditional Medicare have a $1,000 out-of-pocket maximum per year.
Okay.
What that means is that you would then not need to purchase a supplemental policy.
Oh, wow.
And that translates to $250 to $300 a year. I mean, a month in premium that you don't have to pay. And adding a minimal amount of dental, vision, and hearing. Now, I'm not going to say that it's going to be any more robust than what Medicare Advantage plans pay, but it would at least be a step in the right direction, at least acknowledging that our eyes and our teeth and our hearing are parts of our body that need care just like everything else. So that's where we are right now, is we're saying let's improve traditional Medicare so that, and we can pay for that by reining in the overpayment to Medicare Advantage. And then it becomes a cost-neutral piece of legislation, which should resonate with Democrats and Republicans.
Just the fiscal responsibility of our resources.
Right.
You know, I will continue to talk about this move towards corporations and private business because, for example, in this situation, those investors and that CEO, all making money, have no input into your medical care.
Not only no input, no particular interest.
Interest. You know, there may be a doctor thrown in there once in a while, but not usually. They're out to make money.
Right. And I want to just add this, since it's going to be coming up in the next week or two. As most of you listening know, we're going through confirmation hearings right now. And pretty soon, we're going to have the confirmation hearing for the director of the Centers for Medicare and Medicaid Services, CMS. President Trump's nominee to head CMS, which is the agency that runs Medicare and Medicaid, is Dr. Oz, the television personality and snake oil salesman. And Dr. Oz has already said publicly that he would like to make Medicare Advantage the sole provider of Medicare to senior citizens, to basically do away with traditional Medicare, put all seniors in Medicare Advantage, and potentially expand it to Medicare Advantage for all. I would just like to point out to the listeners that at last report, Dr. Oz held in his personal private portfolio over $500,000 of stock in
United Healthcare?
You guessed it.
I hope you all guessed it too. Yeah. So it's kind of there's a lot of expressions. The fox guarding the hen house, and So the healthcare was not talked about. It wasn't an issue in the elections. It was immigration and the economy. Well, I mean, I think healthcare is just synonymous with the economy. But it was just, it's been a struggle for years with Obamacare and following that. And I'm not going to have time to talk about Medicaid, which is our government program for lower income and high risk, the most fragile people in our society. But that is going under the knife under the current administration, and that's going to have a big impact. We've said that we don't want government in our health care. You've heard that term a lot. We have allowed it into women's health. I'll just throw that in. But sometimes big things need to be managed, by the government. Otherwise, we have situations like people having stock in a commercial insurance company or CEOs making a lot of money. But I don't think pushing things to the private sector is really working out for us.
It doesn't appear that pushing the things into the healthcare into the private sector is having the effect that it was supposed to have, which is saving money and improving quality.
Well, I don't see how it makes sense. I mean, we should have been able to pick that out from the get-go.
One would think. And I will point out that traditional Medicare operates on a administrative cost of about 2%.
Yeah,
whereas
the most efficient, and Medicaid the same way.
Right.
Well, I thank you so much for Carol. It's complicated.
It is complicated.
I hope that we've been able to explain that a little bit better to folks out there. And I do want people to kind of keep track of what's going on with some of these confirmation hearings, and also what what the plans are for our health care. I think it could be, it could be bad. It could be bad. So, but we're used to hearing about the doom and gloom in our country, aren't we?
Well, I'm not.
But there's many good things. Government's has gotten a bad name for a long time.
A long time.
Yeah.
And I'm here to say the government is not the
bad
bureaucratic
yeah.
bad guy that it has been portrayed to be.
So pay attention.
I'd rather have my government-run traditional Medicare plan any day.
Okay. Thank you. This has been Common Sense Matters. We'll be back in 2 weeks. We're going to talk about the Tennessee budget. No, don't worry. It's not like a bunch of facts and figures, just some things that, make one pause. All right. Thank you. Thank you, WZYX, for having us.